So today I'm going to show you how to use your postoperative hinged knee brace. Now, not all the surgeries we do for knees require a postoperative hinged knee brace, so this may not apply to you, and if you have questions about that, please contact my office. Now, often you'll come out of surgery and you'll have this brace on, and you'll have the dressings underneath. And the first thing you have to note is that often they'll be stuck straight, and that's on purpose, so you can't bend your knee. Like right now, I'm unable to bend my knee through the brace. There are parts of the brace that you need to know about. Eventually, as we start letting you bend your knee, there are these red buttons on the side, and you push or pull on them for this particular brace, which is a donjoy style brace, where if I pull them towards myself, it'll suddenly let me bend the knee, okay? And depending on what surgery you had, there are times when we let you start bending the knee. It might not be right away. So again, clear this with me to make sure that you're doing the right thing. Now, once I let you start bending the knee, you'll have it straight and locked straight like this. And then when you're ready to get up and start working on your motion, you'll pull them back and start bending. And eventually it's going to get to the point where you don't have to lock it straight anymore, depending on the progress for your rehab. So that's the first step. The next thing you should notice here is on the sides of the brace, you'll have a little dial, and it'll have areas where we'll say -10, 0, 10, 20, 30, etc. And this is actually the degrees of the range of motion of your knee. You don't have to worry about that at all. That's something that I'll adjust for you in the office, because I'll actually be able to use the brace to block your motion from bending too much or getting stuck too straight, depending on what the position is and what surgery you had. So forget about the numbers on the sides. You don't have to worry about that. Just worry about the red buttons forward and backwards. And again, some braces have different mechanisms of locking you straight or bending, but I can show you that in the office if it's a different brace than this. Then the important thing to note afterwards is all of these braces in the front will have a way to be able to take them off. And this one here actually has just clasps that you could loosen up. And you're going to have to learn how to do this, because you're going to want to take your brace off so that you can go take your dressings off and shower and things like that. Now, if you're immediately after surgery, some of the surgeries I'm going to say you need to keep your legs straight. So if you take the brace off, don't suddenly let your leg bend if that's the case. But again, once you take the brace off, this will be normally 2 days or so after surgery. You're going to be able to take your dressings off and change your dressings and eventually shower with the brace off. Just make sure to follow the postoperative instructions in the handout that I gave you after surgery, so that you're doing the right thing, the right exercises at the right time, and keeping the brace straight or unlocked depending on the surgery you had per my instructions. I realize this can be a little bit confusing at times, so if you have any questions, just contact my office and I'll get back to you as soon as I can.